Dutch directness is a double-edged sword, because some people find it a bit too assertive, and but on the other hand, there you there are no secrets. You get what you get, and there's no fluff around it. Now, when you apply that to healthcare in the Netherlands, how Dutch doctors treat their patients is pretty much the same way. It's very, very straightforward. You get no surprises. That can sometimes come off as cold. It can sometimes come off as a bit rude or uncaring, but it's really mostly for the sake of efficiency and effectiveness.
Welcome to We're Moving to Europe. It's a podcast for you if you're an American who's curious or serious about moving to a country in Europe. I'm Casey Kelly. I moved from Texas to Portugal a little over 2 years ago after my young adult kids moved to Sweden and the Netherlands, and now we're helping other Americans research and plan their moves to different countries in Europe without stressing out, wasting money, or losing time. If you want to move somewhere in Europe and you aren't sure yet how to make it happen, you're in the right place. All right, today we're talking with Dr. R.J. Pesigan. He's an American physician who now lives in the Netherlands, and he founded Cornerstone Health to help other Americans navigate the Dutch healthcare system. Dr. Pesigan, thank you so much for joining us today.
Thank you very much for having me, Casey.
Yeah, so how did you come to the Netherlands, and what prompted you to start working with other Americans in the healthcare system here?
I guess I technically moved to the Netherlands at the end of 2020, but this was pretty much a journey that was a long time coming. I've been working as a physician in the U.S. I am board certified in both internal medicine and sports medicine, and I've been working in that capacity for the past like decade or so, and always in the back of my mind, I had always had the thought of what comes after medicine, and it occurred to me that one thing I needed to do was plan for the future, and the thought that came to my mind was to take an MBA, and that's really what our first step to the Netherlands was. So I moved to the Netherlands at the end of 2020 during COVID time, believe it or not, to do my MBA in Rotterdam. I moved with my family, and from that moment on, really, after my MBA, I took on a corporate role working for Philips. I did that for about a year and a half, and then I kind of missed the direct relationships that I had with people who needed my help. And this sort of like formulated in my mind the idea of leveraging my medical expertise in this new country, as well as the experience that I've had, navigating the Dutch healthcare system. So I kind of melded the two together, and created this company. Yeah.
That's a brilliant strategy and an interesting
Thank
career
you.
path to follow.
Thank you. Yeah.
So I only know secondhand because my
Hmm.
son is a university student in the Netherlands. But I think when people hear Dutch healthcare, especially Americans, we think, ooh, free healthcare.
Hmm.
And we just assume it's going to be the same as or very similar to the way things work in the US. So when you're working with Americans,
Yeah.
what kind of big challenges or differences are you kind of coaching them through?
So I like to go through, first of all, like the similarities between the U.S. system and the Dutch healthcare system. So the similarities being that the Dutch healthcare is private insurance based. So you have to buy private insurance, and for the Netherlands, having health insurance is mandatory for all residents. So that means even if you're an expat, if you're staying here for more than 4 months, you have to have health insurance. So everyone buys health insurance. You have different healthcare insurance providers that compete based on price, based on the services that they provide. But the price, the main difference, the first main difference that you find here is that the government regulates prices. So you're not coming in with you're not you don't have health insurance that costs thousands of dollars here. It's very, very tightly regulated by the government, and so you health insurance has stayed quite reasonably priced. And I'm talking mainly about, mainly for expats. So it's very, very reasonably priced for expats compared to what U.S. health insurance is like. The other main difference is that it's not employer based. So whether or not you have a job in the Netherlands, you can have health insurance, and it's all priced the same way. Yeah. So that's really the two main differences between the two.
You and I had talked before a
Hmm.
little bit about just cultural differences in the way doctors approach the doctor-patient relationship, and also
Hmm.
in the way um, the different values that are prioritized in communication, like
Yeah.
interpersonal communication.
Hmm.
And that's something that people in the community that I'm in, they wanted me to ask about that specifically,
Yeah.
for those of them who are thinking about maybe moving to the Netherlands.
Hmm. So one thing, I like to frame this around one of the main values of Dutch culture, which is the Dutch directness. Dutch directness is a double-edged sword, because some people find it a bit too assertive, and but on the other hand, you there are no secrets. You get what you get, and there's no fluff around it. Now, when you apply that to healthcare in the Netherlands, how Dutch doctors treat their patients is pretty much the same way. It's very, very straightforward. You get no surprises. That can sometimes come off as cold. It can sometimes come off as a bit rude or uncaring, but it's really mostly for the sake of efficiency and effectiveness. Keep in mind that many patient visits are limited to just 10 minutes, and so you really have to be very efficient with your time, and that's really what happens with in the doctor's mind as they're seeing you in their clinic. Now, for patients, what does that mean? For patients, the doctors also expect you to, first of all, come prepared, and secondly, to say what you mean and say what you want. So if you want a test, if you believe you need something, you have to come out and say it, and you have to be able to defend your position. So you have to come with evidence. You have to come with certain criteria that makes the case for you wanting something that may be kind of viewed as like special types of treatment.
So I guess maybe similar to the US, in that you can bring your own opinion about what you need as
Hmm.
long as you can back it up.
Yes.
But more direct maybe
Hmm.
than what we're used to. Especially, I come from Texas,
Yeah.
and in that culture, you're not always socialized to say exactly what you mean when you're talking about sensitive topics.
Hmm.
So
Yeah.
it sounds like, especially if that's your MO, you need to kind of prepare
Right.
mentally for a different
Yeah.
experience.
And it
Yeah.
doesn't mean that you'll get what you want, though. And I just want to be like perfectly like clear about that. Um, if the doctor still refuses what you want, you have the right to appeal their decision, and they have to be able to show you why they refused it. And if you still want to pursue it, there are avenues whereby you can appeal that decision.
Is that something that happens a lot, or is it basically just edge cases?
Yeah, it's basically I've never experienced it before. I've always
Mhm.
had very very pleasant visits with my physician. Um, yeah,
Mhm.
I honestly don't know if it's because they know I'm a doctor as well. Um,
Yeah,
but
maybe.
but
Yeah.
conversations with Dutch doctors are not anything to be intimidated by at all. That's what I want to say.
Okay.
Yeah. Mhm.
That sounds good.
Yeah.
Now, when you're talking about like treatment for things,
Mhm.
the impression that I got from my son and from other people I've talked to who've used the healthcare system in the Netherlands
Mhm.
is that maybe they expect you to kind of solve the problem yourself first if it's something
Yes,
minor.
yes, that's
And their
absolutely
definition of what's minor may be different
yes.
from the American definition.
And that's also also another cultural difference that sometimes can kind of clash. um we have very different definitions of what something that's trivial or versus something that's serious. And over here they very much practice ownership, and stewardship. So you need to be able to um kind of you need to be able to try to treat this condition, whatever you might have, on your own before you jump to a medical consult. um, and that can be really scary for a lot of people, because a lot of people don't know if they're what they have is serious or not. um, and so but once you do, step through that door, and the physician is able to see you, uh, diagnosis and treatment comes much more smoothly. But they do expect you to kind of try to treat something yourself before you go to them.
That's good to know.
Hmm.
I guess that's part of having an accessible healthcare system is people kind of you're expected to do your part
Exactly.
to, I guess, keep it from being overloaded.
Yeah.
Um, is there anything else about just in general healthcare, other challenges or cultural issues that you see
I think
Americans run into?
I think the other thing that I wanted to mention is preventative care. Believe it or not, it's not very big here. People locals here tend to go to the doctor only when they're sick. So preventative healthcare is not something that's very well developed here. So if you want to go for, like, let's say screening tests, general checkups, those tend to be something that doctors aren't used to. So you need to be able to kind of, yeah, like I mentioned before, you need to be able to come with a family history of something, certain concerns about your health. Um, they, they they can order lab tests for you. They can order diagnostic tests for you as well. But you have to be proactive about preventative health here.
So, like, can you just walk us through in general,
Mhm.
understanding that everybody's situation is going to be a little bit different, but as if an American family comes, like, what's the process for them in terms of finding a physician,
Mhm.
meeting that doctor for the first time? Uh, is it a public system only, or is it public private like some other
Um,
places?
doctors' practices here can be privately owned, but they all follow the same rules. There are also collectives. So meaning, collections of practices that they're kind of under a certain umbrella. So the way what an expat would expect is, of course, when they come in, they would register with the city. They would get what you call a BSN number, which is like the social security number. And after they get that BSN number, they would then register with what they call a house arts practice or house arts practice. Historically, you would need to find a house arts or a GP that's within 5 kilometers of where you live. And the reason for that is, the GP should be able to do house calls. So you can't live too far away, otherwise they can't go see you if they need to do a house call. Because there is a shortage of medical professionals in the country currently. That's no longer really a rule that's strictly followed. So there are some people who do find GP practices that are much further away from where they live. But it's very important to establish right away with a GP, because they tend to be the gatekeepers of specialist referrals as well. So if you need specialist treatment, you have to have a GP to give you the referral for a specialist. Along with that, of course, there are pharmacies that some GP practices are connected with. You also need to register with a pharmacy.
Okay.
Yep.
So that's something that people need to do pretty quickly after they get that number from the city,
Mm-hmm.
or after they're
Yes,
registered. Okay.
that's
And not
correct.
leave it until they get sick and need a doctor.
Exactly, and also because if
Yeah.
if 4 months go by and you still don't have health insurance, or you don't have well, the there's a penalty for not having health insurance after 4 months.
Oh,
Yeah, there's a you get fined by the government, but
okay.
it becomes very very difficult to find a GP.
Do you want to move to Europe, but you don't know where to start? Or have you started researching different country requirements and you're feeling overwhelmed by all the conflicting information out there? Check out our new membership community. It's a curated learning space where you can discover and compare your options for moving to Europe, get one-to-one support from me, and connect with other Americans who are planning their own moves. You'll also have access to monthly Moving to Europe mini courses, regular live Q&As, and the tools you need to track your progress, along with reliable, up to date information organized so you can find what you need when you need it. You'll also get access to We're Moving to Europe podcast episodes a week before everybody else. And if you sign up now, you get a free 7-day trial to check it out and see if it's right for you. Sign up at We're Moving to Europe on school.com. That's SKOOL.com, or get the link in this episode's show notes. We had talked before a little bit about some of the differences that are more specific to certain groups of people. Like, I know a lot of Americans who take Adderall to treat their ADHD,
Yep.
and it's my understanding that that particular medication is not really an option in many
Yeah,
places. Is that
yeah,
true in the Netherlands?
that is true. There are certain medications that are not available in the Netherlands. I have to check if Adderall is one of them. I do believe it is, or some version of it is. If something is not available, there is an equivalent for it. But for controlled medications like Adderall, you would need very, very detailed medical records from your U.S. physician before you move. So that's one thing I advise to a lot of to my clients. Make sure your medical records are complete; they're very detailed, and that you have a certain amount. That your doses are stable as well. So you are allowed to bring in a limited supply, um, but you need to have a certificate that comes along with it before you move.
Do you know, is there like a government website or anything where Americans can check to see? Because I know even when I've just traveled, sometimes it can be difficult to find out, am I
Hmm.
allowed to bring this medication into a particular country?
There should be. I believe I have it on my website. I also have a link to the website where you can get the medical certificate that you need before you move here with the medication.
Oh, okay.
Yep.
Great.
Hmm.
Okay, we'll put that in the show notes for people who want to go and see that.
Hmm.
The other question I had was about the availability of trans healthcare,
Hmm.
because that's a population in the US that's really interested
Yep.
in many cases, relocating if they can.
Hmm.
And the Netherlands has a really good reputation for being queer friendly and trans friendly.
Yes.
So what's healthcare like there
So
for that population?
trans healthcare is available here. It's covered under basic insurance here as well. Um, Trans healthcare here is also very comprehensive. So when you're assigned when you go to your GP and you ask for that service, you're not just given one specialist. You're given a team of specialists to handle your care, and that includes mental health care. That includes the medication reconciliation as well. If you are looking to transition, there is a team that gets assigned to that as well, and there's someone that follows up with you as well. So it's very very comprehensive care. However, as I mentioned before, there is a shortage of medical professionals. Unfortunately, the main barrier here is the waiting time to get access to that care. As of 2025, a recent article came out that the average waiting time is about six years.
6 years?
6 years, yeah. And that's really not just the Netherlands. It's Europe wide. They can be a bit less in other countries, but yeah, just because there's so much demand, but there's so little like I guess supply. There's too few professionals that are licensed to do it and are specialized enough to do it. Yeah.
Now, when you say 6 years, is that 6 years to even like see a specialist, or are you talking about like transition
6 years
procedures?
to 6 years to see a specialist.
Oh, wow.
Yeah, yeah.
Yeah.
You can potentially get things like mental health care, for example, which typically have a shorter waiting time. But for the for the whole for the whole range of services, that's quite a wait.
And does that apply to like adolescents as well? Or,
I believe no. I don't. Well, for adolescents, you're thinking more of like mental health care as the main priority for them. And in that case, I believe the waiting time is a little bit shorter, a little bit shorter. Yeah,
that, yeah, because 6 years for an adolescent is basically like
yeah,
their whole adolescence,
yeah,
right?
yes,
So,
yeah.
okay, all right. Are there any other things that people should consider, say, if they're coming with a chronic condition, like maybe
Hmm.
they're a cancer survivor, or they have, something like that just needs ongoing monitoring,
Yeah.
like high blood pressure? Um, any specific recommendations or kind of a heads up for them on anything?
For me, the one thing really that I always advise my clients is just have your complete medical records with you. It's not that difficult to transition your care to the Dutch healthcare system. There are medications that uh, the brand name may not be the same, but generically they are the same. So it's easy to maneuver if the doctor here knows what your history is and what your medications are like, and if you're taking them and you haven't changed your dose. So that's always what I try to stress upon my clients.
All right. And then I did have a question about records because in the US and a lot of places they're not really digitized yet
Mm-hmm.
still.
Yep.
So are paper records okay, or do people need to
Paper records are
um
okay as long as they're
okay.
signed by your physician. I have a
Mhm.
template on my website as well as to what like a kind of like a checklist of what you should be bringing with you.
Great.
Hmm.
So is there anything else? We've covered a lot of ground,
Yeah.
so this is really helpful.
Hmm.
Is there anything else that you think Americans in particular coming from the system that
Hmm.
that we have there that they need to plan for or budget for or just be aware of?
I think the one thing that you maybe have to budget for is in terms of like the medications that you will be taking. So it's always a good idea to bring a supply with you, because you're going to expect to have a period of transition from when you move to when you register with the city hall, to the GP and the pharmacy. So there will be a period of time where you're kind of floating. You don't know where to go, and so having a ready supply with you will give you kind of that reassurance that at least I have what I need medically. And of course, you have a lot of resources that are available to you in terms of other expats. So it's not just me that is providing these types of services. There are others like I mentioned mental health, for example. There are psychologists here who are American as well, mental health professionals, people who have specialty in trans care, who are able to provide the type of support that you might need. They may not be recognized by the Netherlands as well yet, but they are able to provide some form of service and some sort of support for you. So I don't want anybody who's thinking of coming here to feel intimidated that they're not gonna get what they need health
Okay.
wise. Yeah.
Right.
Hmm.
Yeah, because everyone, I mean, it seems like a pretty healthy, active
Oh yeah,
country,
it's yeah,
and yeah,
it's one of the healthiest countries in Europe,
yeah,
and I think that's part of the reason why preventative health is such a big thing here. But yeah.
yeah.
Mhm. Yeah.
Yeah. Oh, one other quick question
Mhm.
I had is for the health insurance plans, does it cover things like vision and dental, or are those separate?
You would need a supplementary coverage for those,
Okay.
but again, they're nowhere near the rates that we get in the U.S. And many of them cover things like alternative
Mhm.
medicine as well,
Oh,
which
yeah.
not many. in the US cover. Yeah.
Right,
Yeah.
exactly.
Hmm.
All right. Well, thank you so much.
You're very
And
welcome.
we will include a link to the website for
Hmm.
you so that people can check out those resources that you have.
Hmm.
And thank you. I really appreciate you taking time to talk with us today.
You're very welcome, Casey.
All right. Thanks.
All right.
That's all for now. Thanks for listening, and please drop your questions in the comments. Remember to like, share, and subscribe for more tips about planning your move from the US to a country in Europe. Our producer and editor is Magdalena Lass at Unscripted Creatives. Our music was composed by Sage Barton, and I'm Casey Kelly. See you again soon at We're Moving to Europe.